So ligaments are the structure which can help the joints to join together. So ligaments are the structures which are joining together. So the first one, the ligament is interpubic ligaments, that is between the two pubic bone, that is a fibrocartilaginous disc. Next one is two sacroiliac ligaments, between the sacrum and ilium. Two ligaments are there, present on the anterior and posterior. Anterior also, posterior aspect also, and to hold the sacroiliac joint together. Then sacrococcygeal joint between the sacrum and coccyx. It is present anteriorly and posterior also present. Then sacrotuberous ligament, that also two ligaments are there, extends from the sacrum to the ischial tuberosity. Sacrum to the ischial tuberosity. Then sacrospinous ligament, it extends from the sacrum to the ischial spine. Both sides, sacrum to the ischial spine. That is sacrospinous ligament. In non-pregnant stage, there is very limited movement of these all joints. But during the time of pregnancy and influence of hormones, these ligaments will soften and it will increase the diameter of the female pelvis. Next we will see regarding the false pelvis and true pelvis. What do you mean by false pelvis? So the false pelvis, there is no exact measurement for this false pelvis. It is rounded posteriorly by lumbar vertebrae. So false pelvis backside is lumbar vertebrae, this area, laterally by this iliac fossa, and anteriorly by anterior, here anterior abdominal wall is there. There is no bony provision, so anterior abdominal wall is there over the front side. So the correct measurement we cannot take in false pelvis, but it is support to the uterus during the pregnancy time. True pelvis will support the uterus during the pregnancy time. The next one is true pelvis. So there is exact pelvic measurement for true pelvis. It has mainly three parts. So true pelvis having three parts. That first part is brim. So brim, then inside that cavity, and outside is outlet. These 3 points together, that is outlet. So true pelvis having brim, then inside cavity and outside 3 bony points. So first we will see regarding the brim. So brim is nothing but this is an area where the fetus comes in contact. So brim is the area where the fetus comes in contact with the maternal pelvis. So there are various bony points here. So first we will see regarding how the brim has formed. So on either side, anterior superior border of symphysis pubis, then here is pubic crest, then pubic tubercle, pectineal line, iliopubic eminence, iliopectineal line, sacroiliac joints, ala or wings of the sacrum, then sacral promontory. Once more I will tell you. So this is superior border of the symphysis pubis, then pubic crest, pubic tubercle, then pectineal line, iliopectineal eminence, iliopectineal line, sacroiliac joint, then ala or wings of the sacrum, then sacral promontory. So this is the landmarks of the brim. So these are called landmarks of the brim. Next we will see the cavity. So cavity is round in shape and it is formed above by the pelvic brim. In cavity above is pelvic brim and below by the obstetrical outlet. Outside is obstetrical outlet, above is brim and inside that is called cavity. Okay. So outlet is the last part of the female pelvis. So brim is having, the particular area is called, landmark is called brim. Brim is having 3 diameter. First one is anterior posterior, then transverse and oblique. Anterior posterior, transverse and oblique. The anterior posterior having 3 diameters. Anterior posterior having 3 diameters, that is true conjugate, obstetrical conjugate and diagonal conjugate. True conjugate, obstetrical conjugate and diagonal conjugate. First see true conjugate or anterior posterior diameter divided into 3. In that, first one is true conjugate or obstetrical conjugate or conjugate vera. True conjugate, obstetrical conjugate and conjugate vera. So true conjugate, it is the distance between the midpoint of the sacral promontory to the inner margin of the upper border of the symphysis pubis. It is the distance between the midpoint of the. So hope you understood that one. So true conjugate or anatomical conjugate, it is the distance between the midpoint of the sacral promontory to the upper inner margin of the symphysis pubis. That is around 11 centimeter. That is around 11 centimeter. That is the true conjugate or anatomical conjugate or conjugate vera. Second anterior posterior diameter is obstetrical conjugate. Obstetrical conjugate, it is the distance between the same point, that is midpoint of the sacral promontory to the bony projection in the midline on the inner surface of the symphysis pubis. So inner surface of the symphysis pubis, there is one bony projection is there. So till that point, that is around 10 centimeter. Then diagonal conjugate is distance between the midpoint of the sacral promontory to the lower border of the symphysis pubis. So midpoint of the sacral promontory to the lower border of the symphysis pubis, that also, that is called diagonal conjugate. It is around 12 centimeter. So only the diagonal conjugate can measure through the pelvic examination. Only diagonal conjugate we can measure through the pelvic examination. Next we will see the transverse diameter. So transverse diameter, the distance between the furthest point on the pelvic brim. Distance between the furthest point on the pelvic brim, that is over the iliopectineal lines. That is around 13 centimeter. Then next is oblique diameter. Oblique diameter is, there are two oblique diameters are there. From the right and left sacroiliac joint, it is extending from the right and left sacroiliac joint to the opposite of the iliopectineal eminence. It is around 12 centimeter. It is around 12 centimeter. And one more, there is one more diameter in some textbook, that is sacrocotyloid, 9.5 centimeter. Sacrocotyloid, that is the distance between the midpoint of the sacral promontory to the iliopubic eminence. Midpoint of the sacral promontory to the iliopubic eminence. So that is 9.5 centimeter sacrocotyloid. Then we will see the diameter of the cavity. So its anterior depth is 4 centimeter.